away. I think we need a new one. Alright. Hey everyone, I'm Jared, and I'm going to be giving my presentation on propofol and oh crap, I messed up. Shut up! Alright, take two, Murphy. Hey everyone, I'm Jared, and I'm going to be giving my presentation on propofol and alfaxolone. As of July 2019, according to the DEA, propofol is not a scheduled drug, but the DEA put in a formal request to the AVMA to classify it as a Schedule 4 drug. Schedule 4. Propofol is an injectable anesthetic that provides sedation and slight analgesic effects. Some characteristics include rapid acting, less than 1 minute onset of action. Duration is about 10 minutes for an induction dose, and a single bolus lasts 2 to 5 minutes. It's a white oil in water emulsion. It's made with soybean oil, glycerol, egg lecithin, and disodium edetate. It is isotonic with a pH of 7 to 8.5. Kelsey, go away. Propofol is used primarily in veterinary medicine as an induction or maintenance agent in anesthesia, but can also be used as a sedative for some minor procedures. It could be used before an endotracheal intubation or before an inhalant anesthetic. As for sedation, it could be used in minor procedures like laceration repair, endoscopy, and minor biopsies. I also found that it can be used to treat status epilepticus. Status epilepticus, which is a seizure lasting 30 or more minutes. It is also used as an anesthetic for fish to perform medical procedures. Routes of administration for propofol, it's given intravenously through an injection and must be administered at a slow rate to avoid apnea. And it says about 25% of the dose every 30 seconds is recommended until the desired effect is achieved. Side effects. Pain at the injection site is most common. Hypotension, which is low blood pressure. Myoclonus, or rapid involuntary muscle spasms and jerks. Sometimes it's seen to cause EKG changes, but they're rarely significant. Rarely discolored urine can be seen. In cats, Heinz body anemia could occur if propofol is used too often, and apnea can happen in serious cases, but it's not too common. Ooh. And there is no reversal agent for propofol. Any adverse side effects should be treated until the drug metabolizes. Moving on to alfaxolone. Are we ready? Want to tell us what alfaxolone is? No? Yes. It's a Schedule 4 drug due to it being a central nervous system depressant, similar to other Schedule 4 drugs. It's a neuroactive steroid, and through GABA receptors in the central nervous system, it produces anesthesia and muscle relaxation. Some characteristics of alfaxolone. In cats, a duration of 15 to 30 minutes, longer if the cat is pre-anesthetized. In dogs, a duration of 5 to 10 minutes, which is longer if the dog is pre-anesthetized. It has a rapid onset of action similar to propofol and a high therapeutic index, and it is a clear, colorless solution. Alfaxolone can be used as the sole agent for short-term anesthesia or for induction before further gaseous anesthesia. It is often used in conjunction with other sedative and analgesic agents like opioids, alpha-2 agonists, benzodiazepines, and acepromazine. Alfaxolone can also be used to maintain anesthesia by giving intermittent doses during procedures. Nobody cares. Go away. Go away. Route of administration, like propofol, it's also given intravenously through an injection and must be administered at a slow rate to avoid apnea. I did find in some cases it has been given intramuscularly initially in some non-human primates and for off-label sedation. We're done here. Boop. Side effects. Facial and peripheral muscular twitching, which isn't too common. Muscle tremors and paddling during recovery, respiratory depression, cardiovascular depression, heart rate and blood pressure changes, and apnea, similar to propofol. And also like propofol, there is no reversal agent for alfaxalone, and any adverse effects must be treated until the drug metabolizes. And that wraps up my presentation. And here's my works cited. Thank you. How do I stop this? Started out friends. It was cool, but it was all pretend. Yeah. Since you've been gone. I still don't know how to stop this. Ooh, sorry. Took the time.